Hi, everyone. This is Laura over here. We're going to give a few more minutes for everyone to be able to log on and join, so feel free to make yourselves comfortable in wherever you are choosing to sit on this Friday afternoon, and we will get started in a couple of minutes. We had a lot of people register for this, so we do want to make sure we get plenty of space for folks to log on. This is a very exciting project and funding opportunity. All right, well, some folks are still trickling in, but we can go ahead and start with some introductions and housekeeping and sort of run a show for what we're planning to do today, which fair warning will probably be a super boring webinar about how to apply for super exciting money and really exciting funding opportunities that we as a partner team between AIDS United and NASDAQ have worked really hard and tirelessly to get out in the community. And so we are super excited that you all are here today to both hear more about this project and really the ways that we've been structuring these different 3 tiers of funding opportunities and other technical assistance related to expanding the capacity of syringe access programs to respond to COVID-19. So just a little housekeeping. Let's see, really bad at the housekeeping. So there are 2 ways for folks to enter in questions, and the whole point of this webinar is really a walkthrough and then plenty of time for Q&A around the different funding opportunities and different tiers in this project overall. So 2 ways to enter in questions, because GoToMeeting is not the most intuitive, especially compared to Zoom, so it's a little different. The questions, there is both a chat function and a question tab on your little console at some on the right-hand side. Mine's on the right-hand side. So feel free to enter in any questions as we go along through there. If the question, we'll be monitoring those. If the questions feel like a stop and answer, quick answer thing, we'll answer. If not, we'll save them towards the end. So yeah, feel free to be entering questions that entire, throughout, so that we have make sure that we meet all of everyone's expectations and hopefully get all the questions answered towards the end. And then just as a note, this webinar is being recorded. It will be available for folks who could not make it and could not find the time on this lovely Friday afternoon. Also, sorry, this is Friday afternoon. And I really understand that folks are probably wanting to be logging off. So that's the third, I would say, housekeeping, is that we reserved a healthy amount of time, full hour and a half for this session, and by no means do we have to take all of it. So feel free to, we can make this last as long as it needs to be, but also want to be mindful and respectful of everyone's time. So that being said, I'll just say, so I'm Laura Pegram. I'm the Associate Director of Drug User Health over here at NASDAQ, and I am joined by Meredith McCarthy from our team over here, who is our associate and has just foundational member of our team, as well as Christine Rodriguez from AIDS United. And Christine and Meredith, I'll give you chances to kind of, as we do the organizational stuff, right? So yeah, let's get going. If you want to jump to the next slide. So NASDAQ, is maybe a little bit less familiar for some of you who are from community-based groups or the harm reduction community, but I feel like we have really increased our work over the years with both health departments and community-based groups and syringe access programs on the ground. But for those of you who are less familiar, NASDAQ is a wonky acronym. An acronym that doesn't really make a whole ton of sense anymore, but it might make sense in terms of describing sort of what the organization is, what its history is, and what we do. So it's an acronym for the National Alliance of State and Territorial AIDS Directors. There are lots of reasons that that is no longer accurate, because we work with really across programs with HIV, with state health departments. So the HIV and viral hepatitis programs. We work with health departments in helping support Ryan White and systems of care and integrated health systems, thinking about Medicaid and helping states basically figure out how to increase that coordination for really truly more comprehensive care services. Our drug user health team has really only been a thing for the last 4 or 5 years. And now we are quite a substantial team, and really a team that sort of operates across NASDAQ issue areas, really thinking how substance use, and especially as it relates to infectious disease, really is a cross-cutting issue. It's kind of like that octopus issue with lots of tentacles. Talking about comprehensive care for people who use drugs, we're really talking about touching a lot of different services and access points. And so our team thinks very globally around, holistically around how we approach our work and the unique partnerships and collaborations and ways that we work with both health departments who are supporting syringe access programs, as well as for the last 2 years, we've been tasked with creating the National Harm Reduction TA Center, which is funded by the CDC. So technical assistance and capacity building are available to any syringe access program on the ground. They just made a very brand new website and different ways to really pull all these resources being created into one place. And so you all have better ease of access for requesting that kind of TA. So really super grateful to be here today and to have built this work. And this new project is really an expansion of the drug user health work. And again, sort of focusing on increasing immunization services, COVID vaccine immunization services, but also expanded adult vaccination services in the context of syringe access programs, because we all know that programs really want to be providing more comprehensive care when and where possible, and that they need resources to do it. So I'm going to pass it over to Christine, and we can probably jump to the next slide so that she can tell you a bit about herself and AIDS United as an organization.
Great, thank you, Laura. Happy Friday, everyone. My name is Christine Rodriguez, she, her pronouns, and I'm the Senior Program Manager for Harm Reduction at AIDS United, which is a national nonprofit based in Washington, D.C. So I'm going to talk a little bit about our organization before we jump into the project. At AIDS United, we try to lead the charge for responsive and effective federal, state, and local policies that benefit people living with and at risk for HIV. We invest in innovative models to meet the needs of communities affected by HIV/AIDS, and we've given more than $104 million in direct funding and leveraged $117 million in funding to increase the capacity of communities and organizations that are responding to HIV in the U.S. We try to inform the field with best practices and lessons learned. We advance advocacy based on sound public policy, do strategic grant making to affected communities, do targeted and tailored capacity building for organizations responding to the epidemic, and research and evaluation to inform the field. And I'll say we also work within a social justice framework that challenges the foundational issues of racism, sexism, homophobia and transphobia, socioeconomic equality, gender discrimination, and stigma. Next slide, please. Again, our mission is to end the HIV epidemic. This is how we do it, as I mentioned, through strategic and responsive grant making, capacity building, and policy advocacy, especially among populations disproportionately impacted due to racial health care inequities and other disparities. Next slide, please. And so for more than 2 decades, AIDS United has supported community-driven responses to the HIV epidemic around the country that reach the nation's most disproportionately affected populations, including people who use drugs, gay and bisexual men, communities of color, women, people living in the Deep South, and people, of course, living with HIV and AIDS. To date, our strategic grant-making initiatives have directly funded local communities with more than $75 million, and we've leveraged more than $100 million in additional investments for programs that include, but are not limited to, syringe access, access to care, capacity building, and HIV prevention and advocacy. And lastly, through that portfolio, we provide direct support to about 90 organizations every year that's about to increase, I think, with this project significantly. And we ensure investment in more than 300 organizations through sub-granting partnerships. And in the last several years, that grant making directly touched organizations in 26 of the most HIV/AIDS impacted states, including, or rather, as well as Washington, D.C. and Puerto Rico. So thank you for my AIDS United spiel, for giving me that space. And I'll turn it back over to Laura.
Yeah, so thanks, Christine. Yeah, and super appreciate all the partnership and all the work that's gone into this. This is a true collaboration, and yes, NASDAQ and AIDS United have partnered on many different technical assistance and capacity building projects in the past, and so excited to kind of be broadening the scope of our partnership to really include becoming grant makers jointly. Which, you know, for those of you who've been around in a minute, this is really not completely unprecedented, but there's this part of what's really exciting about this is that you know, federal resources have historically been restricted in the ways that they can show up and be given out to syringe access programs, and really excited to really lean into this just innovative way of thinking through grant making with federal resources specifically related to vaccination, because, you know, NASDAQ and AIDS United have, you know, we know programs and we know how to work with programs on the ground, and also, you know, have a different sort of familiarity than many federal partners, and as well as state partners and jurisdictional partners, depending on where you are. So super excited to be, you know, enjoying, you know, really entering into this project here. So that's exactly what it is. Overview. So the CDC, 4 different centers within the CDC has pooled together money, well, 3 different centers, and some COVID-related money, the ARPA money, has been pooled together and given to NASDAQ in partnership with AIDS United to become grant makers to really improve and expand COVID vaccination on-site services or enclosed referral, as well as thinking through expanded adult vaccination services, specifically thinking hepatitis and you know, Tdap and flu shots and things like this in the context of syringe access programs, and really, you know, building out some more sustainable sort of replicable models for how other programs can take some of these lessons learned and really start expanding those services, and also making sort of the case for why this type of funding directly to syringe access programs makes the most sense, right? We know that these programs have always been central vital touch points for people who use drugs, and that is only compounded and gotten more real and more true and more just real since COVID. And you all know that on the ground, and know it in a way that's more intimate than I do, but certainly, yeah, just really excited to be helping, you know, tasked with and, you know, really given the opportunity to get this going, because it's a big project and it's really super exciting. So if you want to go to the next slide, there's some words on here, and lots of words actually, so I'm not going to read through all of this, but really, you know, the idea here is really really thinking through what does it mean, how does it look, what can programs do to really expand their COVID-19 vaccination services, as well as other adult vaccination services on site or in close referral, and then also how do we just bolster the capacity? And when I say capacity, I mean staff capacity, overhead. How do we really acknowledge and recognize that many programs are already right and trying in as many ways as they can, and how, you know, how important it can be to have increased resources going directly into programs who have been doing this work, funded or unfunded, not going to stop, doors not going to close, right? Anyway, so really super excited to think through and work with all of our who will be selected grant applicants on, you know, really building out and meeting the overall objectives of this project, right? So if you want to go to the next slide. So we have some general intended outcomes, right? Things that will both have to kind of happen to expand meaningful access to vaccines, both COVID-related and expanded adult vaccination, or things that, you know, aspirationally we want to be seeing over the course of this 1+ year project with expanded authority, and we'll talk through what that exactly means. So really thinking about, in order to get, you know, what it would take to increase vaccine access, thinking about increased relationships, improved relationships with health systems, public health systems, and syringe access programs. Really, I think that we are at a place, a sort of tidal change kind of place in the way that syringe access programs have really been recognized as just being so vitally important and essential public health services, over the last many years. And I think that this is due recognition of that journey and that process. So really thinking through expanded capacity building, really on COVID vaccine and services in the context of SSPs. Again, some of that shared language, shared knowledge, shared learning with the harm reduction community more generally. Again, increasing financial resources to go into SSPs to really reach folks who use drugs, folks who aren't stably housed, really making sure that the people who already have the relationships are being given funds to make sure that they can actually do, get more expanded services to the people that they work with. And then also baking in, at the end of this project, something that we'd really like to see at the end of the day is, again, back to those replicable models. What can we learn through the course of this project that will really allow for this conversation around expanded and funding for expanded services in the context of SSPs, whether it's vaccination services related, maybe COVID won't be here, and I don't know, who knows, but really thinking through how do we really bake in and make sure that we are evaluating this project throughout the project in ways that meet this end at the end of the project period, about why increasing capacity of syringe access programs to provide services makes the most sense, right? And I am excited to be kicking this off today, and I think in order to meet these intended outcomes, we really kind of created basically 4 different components and 3 different funding tiers, which we're going to walk through in specific right now. So Christine, I'm wondering if you want to take over to the next slide to give us the broad overview of the 4 components and start us off on the funding bonanza, extravaganza.
Sure. So we're really looking at education and technical assistance resources for syringe services programs to increase capacity, et cetera, that will be widely available, and 3 tiers of funding, a low threshold tier that will be available to 50 to 70 programs, a sort of middle demonstration project tier, tier 2, for 6 selected sites for vaccination services, and we'll go through a little more about what these all mean, and a tier 3 for 2 selected sites to really create an enhanced demonstration project for expanded activities, and the ranges of the awards sort of increase as you go up the tiers, right? So let's talk a bit about each of these 4 components. Next slide. So the first component of the project really is the general education, creating technical resources related to increased COVID-19 and other vaccination services, awareness, and capacity within syringe services programs. We're going to be able to make those resources broadly available nationwide. Those may include, but of course aren't limited to, training curricula, tailored educational materials, and best practice and/or sort of strategic guidance. In partnership with our external evaluation team over at the University of Washington, we'll assess existing and needed resources within SSP networks so we can really make those responsive to the work that you're doing on the ground. And additionally, individual technical assistance requests can be facilitated through our respective project teams, both at NASTAD and at AIDS United. Next slide, please. So the second core component we'll talk about is the first tier of funding, tier 1, administered by us over AIDS United, which is going to award 50 to 70 lower threshold grants to SSPs to increase capacity for all of the things we've talked about, COVID-19 and other vaccination, in particular education, referral, and navigation type services. Applicants can request up to $100,000 for the 1-year project period. This RFP, including application information, eligibility criteria, sample activities, reporting requirements, that sort of thing, is available now on AIDS United's website. You can access it at the following link, which I will pop into the chat here. A volunteer review panel is going to be reviewing and scoring all of the applications based on, of course, eligibility criteria and strength of proposals, with final funding decisions made by our internal review teams at NASDAQ and AIDS United. So note that for this tier of funding, full applications, really the narrative and evaluation components should be no more than 6 pages total, 6 pages total for both your and our reviewers' benefit, if possible. And that does not include necessary attachments and supporting documentation. So you can add in all the things that you need and not worry about that page limit. And Laura's going to take you through the next 2 components.
Yeah, and I'll just make the plug because you said it. Volunteer review is also a Google form that a link that we had put out in the announcement memos for this project. Because this project, I mean, this is a lot of grant reviews, and so we're always really looking towards lightening loads. So if any of you are interested in volunteering on that, we would love and appreciate the support. We'll send you something in the mail, something fun. Yeah, just really excited to be working with AIDS United to get these lower threshold grants out the door. Programs, need money to do the things they're probably already doing, and we need systems to really show what can be possible if we try to build a thing, right? So the second tier of funding, which is technically, it's a little confusing, the third component of these 4 different components, but the second tier of funding is really more of a demonstration project. In fact, the other 2 tiers are definitely demonstration projects. This one, for those of you who might remember about the last time that NASDAQ and in partnership with AIDS United became a funder, was for a very similar sort of demonstration project to expand patient navigation services on-site in syringe access programs with a real range and variety of programs, both geographically in terms of population served, in terms of health systems that programs work with. And that has been a really fruitful learning process with some real replicable models and lessons learned for other programs that are super, super useful. And also, again, coming back to this idea of like, what feels possible if we can just adequately staff programs, right? And actually have dedicated staff to increase these services. And so in this case, we've been thinking about this tier in a very similar way. So we're going to select 6 syringe access programs across the country to basically create or really bolster their current COVID-19 vaccination services, as well as any expanded adult vaccination services that feel possible. So really thinking more about some of the lessons learned, kind of qualitative learning around, challenges, barriers, unique partnerships with different health systems or pharmacy systems, just successes about how to, build out services and in a variety of ways so that, can kind of be a menu, hopefully at the end of the day, other programs who are maybe in a similar boat, thinking about like rural Maine to rural Alabama or something like that in terms of services and accessing services, and just really trying to share some of that general knowledge. This RFP is available on the NASDAQ website, and I think we've linked to both of ours on our general landing page here, which you all have probably navigated to as well. But this is also going to be no more than 6 pages, and we'll walk through exactly sort of what that is, trying to really make the lift light on programs, because listen, you don't have to tell us or try to tell us that you all are doing the work or like can do the work, right? Can do, increase services and want to increase services for the people you serve. Like, don't worry, we're all sold. So really thinking through what are the unique strategies and ways that you would propose to kind of build out some of these services. And again, similar to Christine's caveat that this that is not including any sort of supportive documents or any of the attachments, really just the narrative part and the different components that Meredith's going to walk through here in a minute. Let's see. So yes, one thing I will say, so each of these awards will be we're planning each of these awards to be 200,000, and if the on paper, project period for this has to be 1 year in total, but we do have guarantees of expanded authority, which is a term I never really understood what it was until I started getting CDC funding. But it's basically thinking through no cost extensions to expand the life of all of the tiers of this project. So, don't sweat too much the thought of a solely 1 year, timeline for some of these, especially these demonstration projects, because they are a little bit more intensive in terms of what programs create, in terms of some reporting and documentation for us. So feel free to go to the next slide, because the next slide is the third tier of funding. Oh, that looks a little funny, but that's okay. So this one is I'm kind of a geek, right? Like I'm kind of a nerd. I'm kind of a, I get really excited about these opportunities for learning and really baking in some of the longer term evaluation and sustainability around what can we learn throughout this project process, and also how do we create resources, materials, literature reviews, tools for programs and health systems across the country to really be integrating and meaningfully integrating, successfully integrating these services for the long run, right? And so this one is more of sort of a center of excellence sort of model. So thinking through awarding 2 syringe access programs or drug user health sites to create enhanced SSP COVID-19 vaccination services and expanded sort of adult vaccination services. So really thinking through programs that maybe already have sort of an academic bent or partnerships here and there. It doesn't have to be academic necessarily, but really doing some of the wonky kind of nerdy public health stuff, like thinking through what are the resources that syringe access programs need to be learning immunization registrations or systems, and what are sort of like the complex public health systems and all of the ways that these different things interplay, and how do we utilize these sites to really develop like long-term best practices and evidence base around some of these things, especially thinking through some academic detailing and even providing different types of TA to programs that are trying who are trying to build out services and need some assistance really trying to put those building blocks in place. And so this is, like I said, with 1 year with expanded authority, really thinking through 650,000 per site, because it's going to be a big part of the sort of long-term baked-in sustainability and learning pieces. So this one, these project sites, they get 12 pages, because this is a much different, sort of more collaborative and intensive project that those project sites will work very closely with our core teams, both here at NASDAQ and AIDS United, and also with our evaluation partners at the University of Washington. So super excited to be really challenged to and given the opportunity to award programs and also really get some of this like baked in learning out here in the field, because I just feel like harm reduction programs are so brilliant and already doing so much of this stuff. So I often think of these demonstration projects are like, what are the ways that we can like kind of capture that brilliance and make it broadly useful and broadly relevant. So I'm excited to work with you all on this, all the tiers of this project, because it's a pretty neat project. So if you want to go to the next slide. Christine, are you going to run through this one? Okay.
Yeah. We just wanted to provide an overview of the project timeline for you here. We're already at the 12th. If you'll note that AIDS United Tier 1, just on Tier 1, technical assistance webinar will be next Thursday, November 18th at 4 p.m. Eastern. If you want to register for that, I'm putting the link in the chat. And for Tier 1, we're also holding some totally optional office hours on Tuesday, November 16th, Friday, November 19th, and Tuesday, November 23rd from 3 to 5 p.m. Eastern. If you're interested in those, you can see that information and sign up for a 20-minute time slot at this link in the chat. So completed applications for all tiers of funding, including all required attachments and supporting documentation. Those are going to be due on Monday, November 29th at 5 p.m. Eastern. For Tier 1, you'll submit through an online portal, so you might want to consider applying a little early if possible. So if you run into any technical difficulties, we can help you navigate those. We expect to provide notification of funding decisions on Monday, January 17th, with the grant period beginning on February 1st, with monthly and quarterly reporting that will occur throughout the subsequent year. This is, we're trying to make this as well as low threshold as possible. Numbers monthly, a few questions quarterly, at least for Tier 1. CDC is going to really want those numbers, and we are really going to be interested in seeing your data to show what wonderful work you're doing. So bear with us as we work through that process as well. So I'll turn it over to Meredith to walk through a few components of the application and the process.
Next slide. Oh, thank you, Alika. Okay, so the eligibility criteria for the 3 tiers of this funding opportunity are largely the same, but to start off, we require that all applicants are operating in an area where COVID-19 vaccination as well as other adult vaccination services are possible. And likewise, we also require that applicants are located in jurisdictions that have been included in the CDC's SSP determination of need. And the link featured on the slide shows a map of where those jurisdictions are in case you are unsure if you live in a jurisdiction that has that. Applicant organizations should also hold tax-exempt nonprofit 501c3 status established by the IRS, which AIDS United and NASTAD will require some verification of before we can consider the application, or after when we are considering the application. And any organizations or coalitions that do not hold 501c3 status must have a fiscal sponsor to be eligible for the funding opportunity. Applicant organizations should also be fiscally stable and viable prior to the submission of the funding application, as these funds are not meant to serve as a replacement for any discontinued funding. The funding opportunities of the proposed efforts must be for COVID and adult vaccination among people who use drugs and for syringe access direct services only. Moving on, the selected applicants must be able to utilize the funds within a 12-month period beginning on February 1st, 2022 and ending on January 31st, 2023 with expanded authority to extend its impact beyond the first year. And then one thing to note here is that when you're considering your organization's eligibility and which funding tier you would like to apply for, is that tiers 2 and 3 of this opportunity are cost reimbursable grants. So that means that organizations must have resources on hand to accommodate the expenses of the first month of the grant period, and then after which invoices can be submitted to NASTAD. Next slide. So the application for all 3 tiers has the same main components. The first application component asks for organization-specific questions regarding the type of organization you are, such as an ASO versus a CBO. We also would like to see a brief description of your organization and the general population and geographic area served. Yes, and then we ask for project-specific questions with a summary of how the project proposed fits into your organization's work. The program profile component is looking for more concrete information on your organization that informs its work and function. So here we're looking for an overview of your organization as well as its annual budget and operating costs. Sorry, excuse me. Annual budget and operating costs. We're also looking for some epidemiological data here on your community largely and the clients that you serve. So some examples would be, the COVID-19 transmission rates in the community, drug-related HIV and hepatitis C rates, overdose deaths, or any other health outcomes that disproportionately impact people who use drugs. Then moving on to the narrative component, this component should provide a comprehensive description of how your organization will implement the proposed intervention, as as consistent with the program model that is outlined in the RFP. A summary of the anticipated benefits from this project for your organization and the clientele, and an overview of your organization's ability to successfully meet program expectations. And then in addition to those 4 components, we ask that applicants also submit additional attachments related to financials and organizational structure. So if you could all in your applications, please complete the hyperlinked budget template that is also linked in the RFPs, as well as the organizational representation table provided by NASTAD and AIDS United, and include that in your application. We're also going to require a copy of your organization's current annual operating budget, which includes expenses and income. Yeah, and then please note that if awarded, organizations should be prepared, organizations should be prepared to provide any of the additional financial and organizational documentation that was outlined in the RFPs. Next slide, Alika. Okay, so then all applications for this funding opportunity are due on Monday, November 29th at 5 p.m. Eastern Time. Tier 1 applicants, as we said before, must complete their application on AIDS United's online grantee community. And if you have any questions regarding how to navigate the grantee community, please contact AIDS United's Senior Grants Manager, Shannon Weiss. And AIDS United, as Christine said earlier, will be hosting another TA webinar on Tier 1 grants in the application process on Thursday, November 18th at 4 o'clock Eastern Time. But as for the Tier 2 and Tier 3, applicants must submit their applications by email to NASTAD. They must be submitted in Word or PDF format, excluding any budget-related materials that are generated in Excel. And then if you can email those to druguserhealthta@nastad.org, we would greatly appreciate that. I'm going to pass it back to Laura.
Yeah, thanks so much, Meredith. And yes, this is, yes, we've tried to make this as straightforward and not confusing as possible, but given the very close partnership with both the AIDS United team and the NASDAQ team, this is the most streamlined way that we have been able to really figure out how to really get and receive all of these applications. Yeah, just excited to be here and kind of onto the next component of just really answering some questions. Yeah, perfect. Thanks, Lika. And it does seem like we have some questions that are already in the chat or in the question box. So we can kind of just, jump through those as time goes, but feel free to answer, to add in any additional questions via either the chat or the Q&A box function of this platform. Let's see, so some questions that are kind of popping in. Yes, it is good to see everyone. That's right, thanks. Let's see, so in terms of, there's a question from West Virginia about a program that hasn't been licensed yet in the state, which is a new requirement, new-ish requirement. If I'm really honest, so long as the state has a determination of need and there is like a local or statewide, allowance for the programs, then I don't actually care. That doesn't matter to me as much. I mean, especially if you are seeking the licensure from the state and sort of have that authority to be operating again. That is the particular things around determination of need really are related to federal funding requirements, because again, this is pass through federal funding, and it does carry some different, well, a lot of different types of requirements than more flexible philanthropic funds. So glad to touch base offline if that is helpful on that one. So, and yes, let's see. I guess I messed up when I was saying the different funding tiers between tier 1 and 2. I think I was maybe unclear about the 6-page limit. Both of them have a 6-page limit, and when you're looking through the tier 2 RFP, it is the entirety of part 3. Parts A, organization-specific questions, project-specific questions, program profile, narrative, and then the attachments, including the budget template and all of that, are separate outside of the 6-page limit. Is that clear? I think so. Also, again, feel free to contact us offline or offer in a different kind of clarifying question if I'm not answering questions. Let's see. So we have a question here about someone who sounds like they're probably working with an organization that maybe is not a nonprofit. For the most part, I would assume that many organizations would be nonprofit or have a fiscal sponsorship through a nonprofit status, with the exception of a local or county health department. That's sort of where I'm thinking through that. But so long as you're providing a syringe access services, you're an SSP, right? I would not say you had to limit this to nonprofit only. In fact, I would encourage, county and local health departments who are operating programs to consider expanding, consider some of these funding opportunities, because I think you all might have some uniquely baked in partnerships that we could learn a lot from. And again, many, both of these demonstration projects, this whole project is about learning and trying to really increase services. Okay. Yes, slides will definitely be posted on the website, as well as the recording for this share. So we'll probably have that up sometime early next week.
Laura, we have a question about if health departments are eligible if they have SSPs as part of their programs.
Yes.
Yes.
Yes. Yeah, there's just such a huge range of programs these days, and historically even, some health departments have started some of the original, some of the first waves of syringe access programs across the country. And so, yes, certainly, and that in many states is where health departments have, SSPs have really expanded, especially in more rural communities. So definitely eligible, definitely encouraged. And yes, there's some questions in here about applicants who are applying to one of these different tiers. You are eligible to be a reviewer. I would just put in the note, put a note in there which tier you are applying to, so that we could put you in a review panel pool for a different, because I don't anticipate that there would be crossover in a substantial way. Okay, yes. Let's see. So there's a question here about what supplies are eligible for funding, and this is similar to the way. So this is still, we are under this federal restriction on using federal money to purchase supplies that are syringes used for direct injection of illicit drugs, that are syringes or cookers. It depends in your project proposal how you would propose using different materials as engagement tools, and so really thinking through strategy about how to make some of that argument about services. But in terms of the actual requirements, that is sort of where we're at right now in terms of restrictions related to federal money and syringe access programs. Yeah, there's a good question here about webinars or smaller meetings for folks who are applying for tiers 2 and 3. As of right now, we have not scheduled those out, but if there were interest, we could certainly, I would love to hear that now, and we could put something on calendars just for a smaller, informal, more informal conversation around those application tiers. Oh, yeah, determination of need. So yes, health departments. So there's a question here about, is funding restricted to organizations with budgets over 1 million? And no.
That question might be a reference because Syringe Access Fund had an eligibility requirement that programs have a budget under 1 million, and that is not an eligibility requirement for this opportunity. So it's pretty open as long as you have that determination of need in your jurisdiction.
Yeah, no, thank you for that. That's right. And yeah, this is a unique partnership in so many ways, because like this is NASDAQ and AZ United are doing this very like COVID-19 and vaccination expanded special project, but it is neither part of the Syringe Access Fund, nor part of our regular TA work that NASDAQ does over here. So it's kind of an interesting hybrid, and we know that by both of these funding opportunities kind of coming out at different times, like similar times, that that might cause confusion. So it's good to clarify that pretty explicitly. So good question here about how recipients will actually acquire the COVID-19 vaccine. So the short answer here, well, I don't know if there's a short answer. We would not be expecting programs to actually be procuring their vaccine themselves, right? Largely, especially for COVID-19 vaccination, this would be more about really partnering with existing health systems, existing options for vaccines that are already readily available, whether that's through health departments or sort of pharmacy systems, different types of systems that already are responsible for the purchasing and delivery in many ways. There are unique programs that are, say, partnered with medical centers or something like that, and the vaccine is already available. It wouldn't have to be like project specific so much. So hoping that answered that question, Erin. Okay, good questions, keep them coming. So let's see, a question here about SSPs being anonymous, and how clients would need to provide perhaps ID or at least identification, an identifier in some way or another for COVID vaccines. So really thinking through this service, I like to think of like this service in a similar way that like there are different types of anonymous versus confidential services in the context of SSP. So think about HIV or hepatitis testing and linkage to care, right? So you, yes, have an anonymous program where your folks are, getting their core SSP services. If someone wants an expanded, an HIV test or a hepatitis test, then inherently they go through a different, a slightly more, you collect more data, more info on who that person is, and sort of how to connect with them and communicate with them. And so this is very similar, right? So your SSP folks are still anonymous, and that's cool, but if they were getting referred to or you are offering vaccination services on site, then yes, that expanded service would come with, it would move past anonymous, like that would be a private, more confidential sort of relationship, right?
I will also just add that it'll stay anonymous to you and the vaccine provider. We're not asking for that information in reporting.
Right. Thank you. Yeah, so thanks for that. So is there a standard indirect rate, cost rate for this RFA? Well, it depends on your organization and whether you have an approved NICRA, an indirect rate form that has been approved by the federal government. If you do not, then there is a tier, there is a standard indirect rate that is allowed by the federal government to basically fill in if you do not have that. And that actually brings me to a point that I think, especially talking about federal money, I don't think we kind of touched on this as well, but I do want to note that part of the ways that AIDS United and NASDAQ have really been envisioning some of the TA for this is both about certainly vaccination and COVID vaccination, but also like we are here to help provide TA to make sure that you can get your reports in, that TA around some of this, what I think is kind of wonky federal rules and regulations around this different type of funding opportunity. it really, it's not the most intuitive, right? Like, federal funds, state funds, all come with different kinds of, real, restrictions and regulations, and things that kind of have to be in place to make sure that we as pass-through grant makers are in compliance with all the federal regulations, but we're here to help with that stuff too. So I don't want programs to feel intimidated, like you got to figure this all out yourself. We have done a lot of very intensive TA with our current patient navigation demonstration project, which is very similar, around what some of those infrastructure and kind of building block things are, and how to build them, and how to, we really focus a lot of how to work with programs on helping to build some of that internal capacity to make sure that you all are doing what we need you to do, and then we're good with the government and all that. So I just think that that's a great thing to know. So yeah, so this is definitely, there's a question here about percentage of the budget that should target COVID vaccine efforts as opposed to other SSP services. Well, and the answer is nothing explicitly, but the point of this project really is about expanding COVID vaccination and other vaccination services in the context of SSPs. And so, really thinking through, like, yes, harm reductionists are great at doing many things all at once. And so thinking through some of the ways that, like, providing COVID education and providing testing and providing referral and providing some of the more intensive navigation, happens quite often already in the context of syringe access services. And so really thinking through not so much as things being separate, but how there already is probably some alignment and overlap there in your application would be advisable. Okay. So yes, funds can definitely be utilized to cover personnel costs. That's sort of the overhead, the capacity, expanded capacity. And there are definitely some questions around what if an organization applies for one of the higher tiers of funding and does not receive that. So for the most part, we are really encouraging programs to really spend some time with these different RFPs. There's also a great one-pager that is on, kind of really outlines in more detail each tier of the funding opportunities to, really hone in on which one you think you would be the most eligible for. Just given the sheer immensity of the amount of reviews that we will need to applications we will need to review, we're really trying to encourage programs to really focus in on one or another. I think if there were, certainly we're not making that a hard and fast rule. So if you would want to apply to more than one, I mean, you'd be eligible, but just given the scope of this project and also the tight turnaround for you all as programs, it would be helpful for you all to really spend some time thinking through sort of where you might fit in this puzzle.
And one thing to clarify is that even if you apply for multiple tiers, you can only be awarded under a single tier.
Correct. Thanks. That's good. So we have a question about being able to front sort of like the first month, first 30 days. So this is a great question and clarification. So the three different tiers are structured a little bit differently. Tiers 2 and 3 are structured a little bit differently in the types of grants or subawards, however you want to call it, that will be offered, right? So the 2 demonstration projects are cost reimbursable grants, which means that those organizations need to have enough cash on hand, money on hand, infrastructure on hand to start doing the project. And then after 30 days, you can start billing us for the project. Typically, we can turn around invoices, given that everything is in line and in order, within 15 to 21 days. And so really thinking through like a month and a half. And so that is specific to those 2 demonstration tiers, whereas the lower threshold grants that are going out through AIDS United are more of a fixed rate funding. So Christine, I don't know if you want to say any more about that.
No, fixed rate funding, meaning sort of cash grants out the door. You're not going to have to spend any money and get reimbursed for it. We will cut you checks. Ideally, that first check goes out on February 1st, and you can go do the work as you proposed.
Yeah. So another question here about health department and local health department. If you're offering syringe access to SSP services, yes, you are eligible for any of these. There's a question here about vaccination incentives. And I want to say that I want to follow up on this because this has come up over time with different projects that we have worked with on the CDC. And honestly, I need to ask that question to the larger project team and sort of our compliance folks who are doing, the bulk of the admin and finance over there. Incentives can be, there are limitations, I think, with some federal money about the type of incentive. And I just want to say that I don't know the answer to that right now. But if this person wants to send us an email, we can definitely follow up. Let's see. Yes, so modifying space or administrative costs related to increasing the space where you're located would be an allowable cost for tiers 2 and 3. I mean, I don't know why it wouldn't be allowable for tier 1 either. No, we're not doing this letter of intent thing. So there's a question here about whether that's required, and for these funding opportunities, no. It's just too quick of a turnaround, and I'm glad to see everyone who wants to apply. Welcome. Yes. Okay, great. Let's see. Yes, and you can definitely partner with other organizations. In my opinion, that makes a strong application. A lot of this project is about partnerships with other orgs, with health systems, clinics, etc. So. Let's see. So for organizations who have been doing a lot of vaccination work already, yes, you can certainly still apply and justify to why any of these funding tiers would help bolster your capacity or increase your reach or services. So glad to hear you're already doing it, and absolutely. So like I said, these funds cannot be used to purchase vaccine, specifically COVID vaccine. It would be more about identifying vaccine that is already funded through different community partnerships or different mechanisms, because it's certainly all out there.
Laura, we have a question that says, can you explain the expanded authority to extend its impact beyond the first year? Does this mean that there's a possibility of more money to continue into the second year, or just an expansion to complete your scope of work without additional funds?
Yeah, no, so I appreciate that. So yes, so our project period on paper, because this is federal money and cooperative agreements, and so everything operates on sort of a 12-month time frame. We have these resources would not be, it's more of like a no-cost extension to expand past the first year. And so it would be the same amount of money, but expanded past. There would not be new resources made available. Okay.
Are you seeing other questions? Because I can pull those up.
Yeah, I'm just running through them.
I have another one. If a program is required to have a 501c3 exemption, how is it possible that health departments can qualify to respond to this RFP?
That might honestly just be oversight on sort of. In my memory, our RFP said 501c3 exemption or public health system, but if not, we can definitely change that. That is not our intention for ours. Yeah. So thank you for flagging it. Let's see. Let's see. I guess I'm curious what the difference between a syringe service program versus a harm reduction program would be. To me, those are synonymous. So glad to answer that offline for the person who has asked that question. CBOs and ASNs be considered for funding. And yeah, community-based groups, aid service organizations that are providing syringe access services are all eligible for this funding. No question there. Yes, funds could potentially be used for transportation assistance. I think that that is a super valid use of this type of navigation funds. And I've seen programs do that in many very creative ways. So glad to chat through more or hear more about that and what you propose.
We have a question that says, what would make a great applicant and increase my odds to win the award?
I mean, be a great applicant. No, I'm just kidding. So I will say, here's the thing, is that I know that there are a range of programs out there with a ton of different types of capacity, and that many programs really don't have a grant writer on staff, or don't necessarily have, an intensive, sort of like routine way to go about grant applications. And so, really, in sort of the project narratives and really describing your program and sort of how you are effective in reaching people, I am not looking for perfect spelling. I am, I'm not looking for like, everything to be 100% like beautiful, wrapped up, or super shiny and glossy. Really, I'm looking at sort of like what you all as programs bring to what you all as programs really bring to your communities and the communities that you serve. Really painting a picture of just the ways that you've created your services in alignment with the needs of local communities, the people who use drugs and participants who use drugs. Really thinking through creative strategies and approaches that you're either proposing for this or have built into your programming in the past, and ways that you all as applicants are have sort of a proven track record of how to really think creatively about making the most out of resources and expanded services for folks who use drugs. And I think that to me is really by far the most important. Like I said, around the types of TA that we anticipate providing to really help programs be able to handle and kind of navigate some of the additional requirements that come with federal money, that's like part of the stuff that we can teach, that we can learn, that we can work on with you. So I don't. To me, reviewing applications for this is less about focusing on those, like, do they have, a perfect board of director, like organizational chart and these things in this moment. That stuff we can work on. But I really want to hear more about how you design your program, how you work with your folks, and why you are uniquely positioned to really expand these vitally important services. Christine, Meredith?
Yeah, that feels great. I've got more unanswered ones if you need them.
Yeah, sure.
Yeah. Are there specific goals around the amount of program participants getting vaccinated? Would that be part of the deliverables for this project?
You know, we're not going to set, you know, we're not going to set distinct, like we want to see 15% or 30% or 45, as many as possible. You know, and I think in an application, you know, thinking through some of the ways that you as applicants might actually like approach conversations around vaccine hesitancy or vaccine readiness among your participants might be interesting to kind of start, you know, if you were, say, laying a baseline and then really trying to work within sort of some of the baselines that would be, yeah, some of the what is context specific, program specific. I don't know if that made a ton of sense. No, we're not going to set like hard milestones, but obviously the point here is as many as
Yeah, and I think we're looking for a diversity of programs, and so you're going to have different sizes of program participants and different, you know, barriers and all of these things. But you know, the idea is to provide TA during the course of the grant period to try and help you navigate some of those barriers and increase those numbers as high as they can get. There's no place to put a note into the reviewer info form. Sorry about that. We didn't anticipate the question. If you could just let us know what tier you're applying for within the sort of conflicts section, what boards you're a part of, and who, you know, your employer is, that would be perfect, and we'll sort it out. Thank you. May SSPs partner or just one per grant? I feel like this was addressed. Partnership is great. I think that a single organization would be receiving the funds, but partnership, the more the merrier. Is funding expected to be released soon after the program period starts, or is there an expected delay? Our goal for Tier 1 is to have checks cut on February 1st. So TBD, but that's really the goal.
Yeah. Let's see. So there have been harm reduction programs that don't engage in strong exchange specifically. Syringe exchange. Okay, yes. Due to the federal ban, HIPS was one. Yeah, I mean, so this is definitely about reaching people who use drugs, whether they inject or not. Stimulants are great. It's great to reach other communities, folks who are unstably housed, folks engaged in sex work, folks who are stimulant or non-injectors. This is really about reaching people who use drugs outside of injection. So certainly, and yes, I mean, I'm well aware, we're all well aware that there have been a long history of limitations placed on programs that, you know, from different jurisdictions, different states, and that is just real and true. And so I don't necessarily expect any program to be like, yeah, we've been doing this for 30 years. And, you know, we know that those histories are unique. So certainly good to highlight in applications. So yeah, good question here about the difference between, or highlighting, making a distinction between giving boosters or first shots for numbers reached. And honestly, I mean, I think the richer the data that we can get from, you know, any of these tiers, these funding tiers, as well as the general TA, the better. Right? I mean, it would be interesting to be thinking through like, well, we had this many first shots and, you know, lost to follow up, you know, or unique strategies about how a program would actually increase their, or like outreach services, you know, to kind of ensure some follow up. I mean, that's super interesting stuff. Also thinking through boosters and sort of the interest in boosters, the communication and education, messaging around boosters, all this stuff is really we want to learn from you all and your experiences doing this. And so the more creative in your applications you can be, or thoughtful you can be about different ways to capture some of that real learning, strongly encourage it, because y'all are super smart and smarter than us. And this has just been, us trying to really figure this out in a way that feels meaningful for programs.
I wanted to address quickly some logistical questions that are coming in, I think, around Tier 1. If you are trying to access the application and find that you can't, we are in the process of testing it to make sure that everything works for you on the public side. The application should be available for submission within the next few business days. All of the questions, all of the required attachments, all of that information is in the RFP, so you can definitely start preparing your application in advance, and that will be live as soon as we can possibly get it up there.
Yeah.
And if you're having any trouble downloading the attachments, whether that be the representation table or the project budget, those are the two that are organization specific that we'd like you to use those forms. Please just email and I'll send those as attachments, and apologies in advance if you're having trouble with those downloads.
And they are very similar. Let's see, and then we have another question about the purchase of a mobile unit as an allowable. And so what I'll say is that purchasing things with federal funds does not really, I mean, there have been some examples of sort of jointly purchasing or using different, or like shifting some different organizational resources to shifting from this project to different parts of your organizational budget. The thing about it is much easier in our experience to be in compliance with federal money to rent, although I know that like with outfitted mobile units that does not really make the most sense either. But since this funding is not ongoing federal funding, it would seem very likely at the end of the project period, the federal government would say, okay, give us our mobile unit. So I'm glad to chat and answer email questions around that in particular, but it's a question that came up a lot with our patient navigation project, and that's pretty well where we live on it. Yes, leasing works. Yes. Thanks, Kate. Yeah, and good advice here from some folks who have definitely applied to Syringe Access Fund and NASDAQ funding in the past. Definitely good advice to prepare applications offline in a Word document, and then just be ready to add them all into the portal all at once, just in case there are technological malfunctions, because we know that stuff happens all the time. Others? That was a lot of questions. Good questions. Well, yeah, seeing no others in this moment, I just really want to kind of head back to just how super exciting this project is. I feel like we've come so far in terms of real recognition for just like how invaluable syringe access programs are, and you all did that, right? Like that's all you all who are supporting programs, who are working in programs, who are running programs. This is a community effort that really has gotten us to this really exciting, innovative project. And I feel super grateful for the work that you all do, and excited to show it off and show off how just brilliant you all are, and thoughtful and strategic you are in the ways that you show up for your people, and really expand services, because that's what we want at the end of the day, right? We want people to have more access to more care by people who are kind and not jerks, and really building the case for why this does make the most sense. And I really feel grateful that we at NASDAQ and H United have been chosen to help find ways to really highlight your brilliant work. So super appreciative for all of you, and for our great partnerships and our federal partners and our everyone who's really put in a lot of effort to make this possible. So I think we can leave it there. Christine, Meredith, you want to say anything?
Nothing to add. I don't want to take up any more folks' time on this Friday evening, at least on the East Coast. Yeah, thank you. I'm really looking forward to seeing folks' proposals. Reach out if you have any questions during the application process. We're here to support folks getting applications in successfully. So just let us know.
Mm-hmm.
Yep. Thanks, everyone.
Cool. All right, everyone go have a Friday evening, whatever that is. And we will hopefully be in touch with everyone soon. Okay, have a great weekend and talk soon.